22 years ago, I gave birth to Tristan, and today I buried his ashes under this tree. You know, every day people are dying and families are being broken, and this is how birthdays are being celebrated, right? It's like, this is my son's birthday party. This is it.
By the time Tristan was a teenager, cocaine had taken over his life. His mother, Kathy Wagner, tried desperately to help him, even taking Tristan to China when he was 16 to pursue his passion, kung fu, and to get him away from drugs. For a while, it worked. But just 10 weeks ago, Tristan relapsed. He used cocaine that was laced with fentanyl, and it killed him. The coroner's office says in more than 80% of street drug deaths in British Columbia, those drugs contain fentanyl.
Many people out there are deliberately poisoning drug supplies. And they're poisoning drug supplies because it creates more addicts, creates more market, and is easier for them to transport. And they don't care about the number of the deaths along the way.
These are some of the faces of the fentanyl crisis in BC, the boy next door or down the street. That's Tristan on the left, his friend Scott Gu and Ian Chalmers. Scott and Ian are still alive, but their parents worry for how long.
Pops out at me everywhere now.
Oh, that's interesting.
Yeah.
I visited their mothers at a cabin on BC's Sunshine Coast near Vancouver. Their son's addictions have brought them together.
I had based my everything on how he was doing.
Luke Cameron's son Ian has struggled with cocaine and the risk of relapse. Here he is celebrating clean time at a recovery festival last year. Carrie, her neighbor, knows Lou's struggles well. She's here to offer her support.
And then indeed more starts to emerge, and it's...
Deb Gu's children have substance abuse problems, and she worries every day.
I wish we were all better able to know our kids or anybody else at that deeper level when they're still alive.
And then there's Kathy. She says Tristan understood the risks, that his cocaine would likely contain fentanyl, and if there was no one there to help, an overdose would kill him.
Why do you think it happened the way it did?
It happened, I know why it happened the way it did. It's because he was ashamed, right? And I think people, particularly in recovery, are so ashamed that they can't do it. They feel like it's a failure. They talk the talk. Why can't they walk the walk? And that's shameful to them.
It knows no bounds. It can hit at any level, any socioeconomic status, any neighborhood, anywhere, any age, any time.
It came to Kathy's house. You know, and at your son's service, Kathy, I'll never forget the moment that my son attended. And Kathy came across the room to hug Ian. And I stood there feeling a real mix of emotions, knowing that it could have been me at my son's service.
There are many reasons people are using drugs alone, whether it's shame or not fully understanding the risks. These women feel there is one more step governments must take.
The other big elephant in the room is the safety of the drug supply. And you know, it is poison.
Honestly, the only way that I think that's going to make a huge impact on that is to legalize and regulate drugs, and I know that that's not a popular stance right now.
As we're talking today, 4 or 5 people are dying in British Columbia alone. How can we not care? How can we as humans not care about this story? I hope it never comes to your house.
Cameron says there's nothing she can do to ensure her son doesn't relapse and risk death by using drugs alone. That's why she volunteers in Vancouver's downtown east side, where the fentanyl crisis first hit Canada.
Getting almost good here.
A tent and trailer run by volunteers who have the life-saving drug naloxone if there's an overdose.
Hey, have a good day, eh?
Though she worries so much about her son, being here gives her comfort.
I know, sadly, that I can't save him. If I could, I would have saved him a decade ago. But what I can do is I can be down here, and nobody dies when I'm here. And that's really empowering. Nobody dies on my shift here.
Watching people using the same contaminated street drugs her son might use, with no one around to save him. For a lot of people, legalizing and regulating the drug supply may seem like a radical idea. Most politicians don't want to go anywhere near it. But today, BC's Minister of Mental Health was asked about whether a new approach was needed. Here's her response.
I think it's time to have a conversation about that. I think we should be prepared as a country to have a courageous conversation about it. In the meantime, we are pushing the envelope and we are being bold and innovative and doing everything we can within the context of the present federal framework.
Meanwhile, the city of Vancouver has essentially decriminalized possession of all drugs, including heroin and cocaine. A senior police officer told me they only arrest people in special circumstances. For example, if the drugs are near a school or a community center. In Calgary, police also say they generally don't arrest for possession, though they will confiscate the drugs. Ottawa police still make arrests, but officers use discretion there as well. But in Toronto, Montreal, Edmonton, and Halifax, the police departments tell us it's still by the book. They enforce the laws against possession.